Legionnaires' disease. Legionnaires' disease is a form of atypical pneumonia and also known as legionellosis. This disease is caused by a bacteria called Legionella pneumophila that accounts for 90% of the cases. Other types include L. filari, L. longviti, L. annisa, and L. migdadi. Normally, Legionella grows in water system of buildings. The bacterium can get aerosolized along with water vapors, and then these small water droplets are inhaled when people breathe in contaminated air. However, these bacteria don't normally spread from one person to another. A very few such cases have reported where the infectious agent was transmitted from patient to caregiver. Sometimes the bacteria infects the lungs through aspiration. That means when a person drinks water contaminated with Legionella, then some of the droplets enters to the respiratory system during drinking that may affect the lungs of healthy person. But a good thing is that most of the people infected from this bacterium don't get sick. There are certain people that are more susceptible to this disease, and that include people having 50 years or older age, smoking habits either current or previous, chronic lung disease, compromised immune system, cancer patients, or other underlying disease including diabetes, kidney, or liver failure. The incubation period of this disease is about 2 to 10 days. The incubation period is actually the length of the time when a person first exposed to the bacteria and when the symptoms appears first. In some cases, the incubation period can reach up to 20 days. Generally, 0.1 to 5% of those people develop disease that exposed to bacteria, while in hospitals, around 0.4 to 14% develops the disease. Now let's talk about the symptoms of this disease. The most common symptoms of Legionnaires are fever, chills, and dry cough. All the patients feel fever, while only 50% develop cough that can be either dry or with sputum, and 33% shows the symptom of cough with bloody sputum. There are some other symptoms that include headache, chest pain, muscle aches, loss of appetite, tiredness, loss of coordination, diarrhea, vomiting. Neurological symptoms include confusion and impaired cognition. Now let's see how we can diagnose this disease. Usually, chest X-ray is performed to confirm the pneumonia caused due to Legionnaires' disease. Two types of tests are normally performed to determine either Legionella is causative agent of the pneumonia or not. The tests include urine test, and the second one is identifying the bacterial presence in sputum sample or washings from the lungs that were collected from the patients. For the treatment, Legionella infections are normally treated with antibiotics. Since the bacteria grow inside the cells, therefore those antibiotics are recommended which has the ability to penetrate inside the cell. The antibiotics include tetracycline, macrolides, ketolides, and quinolones. Recently, quinolones like gamifloxacin, moxifloxacin, and levofloxacin, or newer macrolides like roxithromycin, clarithromycin, and azithromycin are used. Among these, doxycycline, azithromycin, and levofloxacin our most recently used antibiotics. Let's see how we can prevent ourselves from this disease. Some of the preventive measures that we can adapt are: the temperature of water should be kept below 20 or above 50 degrees Celsius because this bacteria is able to grow between 25 to 45 degrees Celsius with optimum temperature of around 35 degrees Celsius. Chlorination of water and other methods of disinfecting water system can be applied like UV, copper sulfur ionization, and other methods. Prevention of biofilm formation. Those construction material should be used for water system that doesn't encourage the formation of biofilms. The water system should be designed so that it reduces the formation of aerosols. All these measures should be adapted to prevent oneself from getting this disease. Thanks for watching the video. Thank you for watching the video. Please subscribe to our channel and click on bell icon for more videos.